Hi, I'm Dr. Kimball Johnson. I'm the Medical Director of iResearch Atlanta.
And I'm Dr. David Purselle. I'm a psychiatrist with iResearch Atlanta and Georgia Psychiatric Consultants.
We want to let you know that we're being very proactive about any CDC guidelines regarding COVID. We're being proactive about infection control, washing our hands, washing our instruments, keeping our lab areas, our patient areas clean. We are quite dedicated to keeping our staff healthy, as well as our patients healthy, as well as visitors.
So you know, what I hear on the news is that we've got to do a lot to not only make sure our hands are clean, but to make sure we're not touching contaminated surfaces and things like that. Maybe you could tell us a little bit about what we should try to avoid and maybe demonstrate how we wash our hands, because I think that's it's not just get in there, rinse them off,
Right.
paper towel, wipe them off the jeans, and walk out the door.
And we are trying to do social distancing. It's hard to do that in a video, but we are quite aware of it through the office. We do have desks that are spread apart, and all of our staff members, as well as any kind of patient flow, we're trying to keep people 6 to 8 feet apart. Regarding hand washing, yes, it does need to be at least 20 seconds. We have a sink. As you can see, we've got all types of alcohol, over 70%. As regular soap and aseptic soap. We also have wipes. These are actually used for the lab counters. We use gloves with these because they are actually too strong. And I will always wash my stethoscope. I usually start with alcohol first. And I usually get a paper towel out ahead of time. I put it on it, and then I use soap. And then I really do try and count to 20 seconds, however you want to sing
yeah,
it.
so there are a variety of ways, but you could count out the 20 seconds. You could sing happy birthday. Don't do it in triple time. You've got to do it the normal pace of happy birthday to you. And you really want to make sure it's that 20 seconds.
And I get up on my watch, my forearms. I'm cleaning out under my fingernails. I really am scrubbing the back of my hands. And then after I wash my stethoscope with alcohol, I'm also washing it with soap and water. And then after, I really try not to touch as many fomites as possible. I touch one piece of paper towel, use the clean part of the paper towel to shut it off, and then I'll wipe off.
And for those of you who don't know what a fomite is, any type of surface or object where bacteria, viruses may grow and breed.
Like stethoscopes, pins, doorknobs, the tops of these, the handle for the water faucet. So we're trying to teach ourselves and our staff, like I said, about social distancing, about keeping things clean, and trying to follow as many of the, follow all the guidelines per CDC as the data comes out to try and keep everybody safe.
What other important things might there be with regards to helping to prevent the spread of the virus? You know, we talked about kind of wiping things down, but are there certain things that we should use to clean the surfaces? Do we need to use Pledge, or is there something else that we should be using?
For washing our hands, soap and water actually is excellent. When you don't have soap and water, then alcohol, preferably above 70%. There are ammonium chloride compounds that are also good. As you notice, when patients come into the office, we are checking their temperature. We're using 99.5. That may actually change and go down. And obviously, anybody that has any signs of cough, feeling feverish, feeling ill, any risky exposure as far as travel, or patients who have been diagnosed with COVID, or a person under interest or investigation.
Any type of flu-like symptoms, cold symptoms, these are the types of things we really want to try to avoid coming actually into the office.
I mean, think about it. We're in the middle of allergy season, it's flu season, it's cold season, and it's COVID season. So we're trying to actually be proactive. A respiratory virus is a respiratory virus. Yes, COVID is serious and it appears to be more infectious and possibly more lethal than flu, but it's still infectious. Flu is still infectious. Colds are still infectious. And we don't want any of that spreading around. It's also allergy season, so trying to determine what's an allergy versus any respiratory infection, we want to keep all respiratory infections out of the office and our patients and our staff healthy.
So for wiping down surfaces, you know, I think we've got the special wipes that really you're not going to be able to get as a consumer. But there are other things that you could use, maybe like a Clorox wipe or a Lysol wipe.
any of these. And if you don't have that, you can do a couple of tablespoons of bleach in water and use that to wipe down surfaces. Also soap and water, particularly if you scrub, and wipe down. With most household cleaners actually appear to do well. The alcohol base probably do a little bit better. And
So can I just clean my counter with my vodka?
might be a waste of your vodka. But if that was all you had left, but ideally you want to use an alcohol prep.
All right.